Let's begin with the big story we're tracking this evening. First up, we're taking a look at what's happening with COVID-19 and the Delta variant, a variant of concern as declared by the World Health Organization, is actually showing that concern in many parts of the world, especially in the United Kingdom, where a significant part of the population has been vaccinated. Nearly 40% of adults have been vaccinated with both doses. Yet they've seen a jump up in cases and they're putting it down to the Delta variant. In fact, it's making them postpone their unlock plans, which were supposed to set in from the 21st of June. Now, in the Indian context, the Delta variant has shown to cause COVID-19 even in those who have had the jab. This has been shown in an AIIMS study, which was released yesterday, and shows that vaccine escape or the vaccine breakthrough is being caused because of the Delta variant in Covishield and Covaxin. Important thing is no deaths were seen in the 63 people that AIIMS did the survey on, despite having a high viral load. All of these people had taken one or both doses of the COVID-19 vaccine, but they had 5 to 7 days of high fever. They also showed a viral load high irrespective of the vaccine type or status. That means whether it was Covishield or Covaxin or one jab or two, the viral load was still pretty high. So what does this really mean for the vaccine rollout as well as for the fight against COVID-19 in India? Because the Delta variant is pretty prevalent in India. It first originated in India and is definitely something we're battling with. Dr. J.P. Muliyil is with us. He's a top epidemiologist and a member of the NTAGI. Dr. Muliyil, thank you for speaking with us here at ET Now. Let me begin by asking you about these concerns with the Delta variant in context of the AIIMS report that I have just spoken about. Is it now clear that this variant is the reason why so many people are reporting getting COVID-19 even after one or sometimes both jabs of the vaccine?
With vaccination, breakthrough infection is very well known. And the best hope is to follow this little rule that when you get vaccinated, your chance of getting a breakthrough infection is 50% as compared to that of an unvaccinated. In other words, there will be breakthrough infection, which is not a bad thing because it actually gives you a little upgradation of your immunity. The advantage of the vaccine, it prevents you from getting into serious trouble or dying. So that is the way you need to view the breakthrough infection. Now, in the study that from us come as with AIIMS, that we see that people with one dose and two doses have got some breakthrough infection. But that doesn't mean that the vaccine is not protective in the normal sense we use the word protective effect of the vaccine. Protective effect of vaccine is meant to prevent serious disease, not infection. It does, to some extent, reduce infection, but a whole lot. Just because you got this variant from these people who had breakthrough infection, that does not mean that this the vaccine that they have received is not protecting them. That is a different issue and need to be studied separately. Isolation of the variant is not a confirmation or even such serious suggestion that vaccine is not working. No.
Now, the big question then, Dr. Muliyil, is that what about this gap that NTAGI has also recommended between two doses of Covishield? We've moved it from 8 to 12 weeks to 12 to 16 weeks. Now, clearly, it's the science shows that the Delta variant can ensure that you still get COVID-19 even after one dose. Is it then safe to have such a large gap between two doses?
I think these are two questions. What do we do when we seriously have a deficiency of vaccine available in the country. You maximize the use of vaccine so that most efficiently we can use it. So that the one dose now, the second much later, allows a larger number of people come under the umbrella of vaccine, regardless of which variant. Okay, at the moment. Now, and we are not saying don't give the second dose, because first dose seems to do quite a lot of work, and natural justice seems to demand that let's get as many of the high-risk group under at least one dose. That's a priority. The second question you are somehow suggesting is that the Delta variant is not honoring the vaccine-induced immunity. We have to worry about that allegation, but we have no evidence now. Like I said, breakthrough infection is not an evidence that it is not protective. It is done all the time with all variants. Breakthrough infections have occurred. So that these two questions are to be treated separate.
Professor Muliyil, when I spoke to you last, you said, and that was towards the peak of the infection and the second wave, you said that the second wave will come down as fast as it has gone up. And that's exactly what has happened. We've come down from about 4 lakh daily cases to below 1 lakh daily cases pretty quickly, almost at the same speed as which the cases rose. What does that tell us about an impending third wave? Can we, A, say that the second wave is behind us, and B, say that the third wave is inevitable, or can it be avoided?
Well, the sensible question to ask is, why is the numbers coming down? And there are exactly 2 reasons. One is the number of susceptibles are coming down. Number 2, there are susceptible, but they are all hiding. So you may be able to artificially bring down the wave through severe suppression of exposure. In other words, a heavy lockdown. I don't think we have done that. So most likely, this reduction is due to a fall in the number of available susceptibles. There is a level of comfort virus need to spread itself. And that is exactly what we want to prevent it from having by having a wall of immunity, which is called the herd immunity level, which many people don't like, but that is a fact. Once that is reached, naturally, the epidemic has to come down. So if many people keep asking in the same breath, does it mean a third wave will come? A third wave also, you need to have a variant that is highly infectious, but then sufficient number of people who are susceptible. So far, all variants have honored the previous virus's infection-induced immunity. So there is a comfort in that. A new variant which ignores all the other previous infection can occur, theoretically, but very unlikely. So I will feel comfortable to say there may be still areas where there are lots of uninfected people, unvaccinated people, and there may be outbreaks there. But to know the truth, we need to do a nationwide sero survey to assess what percentage are immune. If it is something like 70% or more, then we can relax and assume there's unlikely to be a third wave.
By that logic, though, Dr. Muliyil, then is it fair that there are concerns that children will be most susceptible in the third wave because they have relatively been seeing less infections and will possibly not have vaccinations till quite some time. Everyone else will be vaccinated before them.
The interesting thing is the infection rate in children. We never measured below the age of 5, but other age groups, youngsters, has been equal to the adults. That is what many of the surveys done, especially the Delhi one, showed, that the rate of infection, even among those, the teenagers, is exactly equal to that. We don't know about the serological profile of under 5 because no one has done. I agree with that. But children seem to have kept up the same ability to prevent disease, or exactly like everywhere else in the world. So if a new variant arrives, which changes that equation, we are in trouble.
All right. Thank you so much, Dr. Muliyil, for speaking with us in an exclusive conversation with us. Top epidemiologist Dr. Muliyil is saying very clearly that the third wave may not be that bad because a large number of people have possibly gained immunity because of the size of the second wave, as well as a vaccination program. We, however, do need a nationwide sero study to determine how far and wide that infection has really spread.